Curious about Botox and fillers? Well, today I'm pulling back the curtain and showing you exactly where I get injections and why. Let's talk about best placement for natural, youthful results. So first of all, what is Botox? So Botox is actually a neuromodulator. The long name is botulinum toxin A, and it is a neuromodulator that comes in many different brands. So there is Botox, Xeomin, Dysport, Jeuveau, Daxxify. These are all forms of neuromodulators. And what they do specifically is prevent that communication between the nerve and the muscle. And so when you are wanting to frown, for example, or raise your brows, you'll still be able to do that, but just not as forcefully. So it helps to make these movements a little more subtle. And there are strategic ways to place Botox so that you don't have this frozen look. And that's really the goal, is just to ensure that when we're injecting neuromodulator, we place it strategically so that it softens the movement but doesn't necessarily cause a frozen look. Typically, Botox lasts about 3 to 4 months, and it's best for preventative aging, which means if you get it early, you can prevent etch lines forming in the skin, and also for softening expression. So let's get into where I get Botox and why. And again, Botox is not for freezing the muscle or making you look frozen. It's about a subtle, natural looking enhancement. So here's exactly where I get it and why. First off, I typically get it in my forehead. Why? Because the forehead muscle is called the frontalis muscle, and its job is to elevate and lift the brow. So you can see right now, my Botox is wearing off, so I do have movement, a nice sort of natural movement in my brow. This muscle helps lift the brow, but in return, it creates these horizontal lines on the forehead. Now, a small amount of movement on the forehead is totally natural and normal looking, but often when people are very expressive, they get etched horizontal lines on the forehead. Some call it a barcode, some call it a pack of hot dogs. Either way, there's a way to prevent those etch lines from forming with neuromodulators so they don't end up leaving permanent marks in the skin. Now, it's really important to go to a skilled injector when injecting the forehead, because too much neuromodulator in the forehead can actually contribute to a heavy brow, which kind of flattens and pushes the brow down. And if it's too heavy, then you'll have a hard time lifting your brows up, but also putting makeup on. You'll notice that it's a little bit harder to put makeup on your upper lid because you're not able to lift your brow. So Botox in the forehead has to be placed very strategically, small amounts spread across the forehead to achieve a natural result. Next, I always get neuromodulator right here in my frown lines. Now you can see that the treatment is wearing off a little bit in this area, but I do have a subtle movement in my frown line. Now, once these 11 lines become etched, there's really nothing positive about that. Most patients say, I look angry, but I feel happy. I want to get rid of these lines. Everybody asks why I look so angry. And so this is an area you can really go to town. Nobody really wants to look like they're frowning all the time. And so it's really important. My suggestion is if you want to start somewhere with neuromodulators, you start with a little bit right here to prevent that sort of angry scowl movement. Now, interestingly, there have been psychological studies to show that when patients can't frown anymore, they're not able to make that negative scowling expression, they actually feel happier. So Botox in the glabellar area can actually affect your mood overall. So there's really no reason not to get it there. Now, one trick that I love to do with Botox is achieve a little bit of a brow lift. So when you strategically inject Botox in the glabella and then on the lateral aspect of the brow, which is that orbicularis oculi muscle, you are able to create a little bit of lifting of the brow. Now, this can be a really nice effect for Botox. Often patients are asymmetric, and so one brow sits a little bit lower than the other, and we're really able to help achieve symmetry when we inject strategically on either side of the brow, on either side of the lateral brow, and also in the glabellar area to achieve that brow lift. The next area that I normally get Botox or neuromodulators is around the eyes. So there's a muscle around the eye called the orbicularis oculi, and that contributes to your ability to close your eyes really tight so you can see these horizontal lines forming around my eye. And it also contributes to the development of crow's feet, which are these horizontal lines that over time will become etched along the side of your eye. Now, some people don't care about those. Some people absolutely despise them. In my case, I like to keep them soft. I don't want them to become etched in the skin, but I still want to be able to smile naturally so that it doesn't look frozen and my cheeks actually move. And so I get a little bit of Botox around this area, my crow's feet, to help soften those lines so they don't become etched. It also keeps your eye area looking youthful and refreshed. The eyes are one of the first places that tend to age or show signs of aging, and so we start to develop crepey skin under the lid and lines at the outermost part of the eye, as I mentioned. So a little bit of preventative treatment around the eyes can really help preserve that youthful look. Now, sometimes when you inject the frown muscles and you're not able to frown anymore as forcefully, now I have a pretty good frown at this moment, but sometimes when it's just kicking in, we tend to compensate by using these muscles on the side of our nose, which we call bunny lines. So you can kind of see them form. Now I'm frowning, both my brows go down and my nose muscles kind of make that bunny look. And so we're able to inject the sides of the nose to help soften the look of those bunny lines as well. Now these are some of my favorite but kind of secret places to inject because not a lot of people know about this. So moving on to the lower face, the other area that can be injected is actually right on either aspect of the nose. This treats a muscle that contributes to a gummy smile. And so often people smile in pictures, they smile real big. I can show you. You can get a gummy smile where there's just a lot of gum show and can look a little bit unnatural, a little bit forced. And so every 3 to 6 months or so, Botox can be injected into the lateral aspect of the nasal ala to help to soften that gummy smile. Now moving on to the lower face, another awesome place that we can inject is actually the masseter muscle. Now this is a muscle that helps with your chewing, but some people overuse this muscle and tend to clench their jaw, grind their teeth, and have TMJ pain all along this area. So not only does treating the masseter muscle help with those real medical symptoms, it also can help slim and streamline the face. So when the masseter muscle is overused, it creates a bulge type appearance right along the jawline, which can actually masculinize a female's face. Now this is a very common procedure actually in Asia because Asian faces tend to be a little bit more round and less oval shaped. And so by treating that masseter muscle, it can really help to transform that jawline to make it be a little more oval looking. But treating the masseter muscle can be a game-changing treatment for people who suffer from TMJ, jaw clenching, or pain when chewing. And so we inject a few areas right here along the muscle that again lasts about 3 to 4 months and can be a real game changer in a lot of patients. And so treating the masseter muscle can actually slim the lower face for a more sculpted look along the jawline. Treating the mentalis muscle on the chin helps balance the face for a more relaxed look so you're not so tense all the time and puckering in that area. Now the lower part of the face can also be treated. There's a muscle called the DAO, which stands for depressor anguli oris. And what it does is contribute to the downturned corners of the mouth. And so a lot of people kind of hold their expression like this, which is basically frowning with your mouth, and the DAO can be treated so that you're not able to make that expression. Now I joke in clinic all the time that if I froze all of these areas on my face, I wouldn't be able to show you. So I haven't treated this area in a while, but really this treatment can really help so that your corners of the mouth don't become downturned and they stay nice and perky and uplifted. The other treatment in the same exact area can be in the mentalis muscles. The mentalis muscle contributes to dimpling of the chin. Now, this might not seem like a big deal, but over time, some people tend to hold their chin in this dimpled position, and it leads to shortening of the chin and the jawline, and also a permanent change in the texture of the skin, which we call peau d'orange, or like an orange peel type texture. And so putting neuromodulator or Botox into the mentalis muscle really helps to soften that movement. Now, the last place neuromodulator or Botox can be injected on the face and neck area is actually into the platysmal bands on the neck. And so the platysmal bands are the bands that contribute to this sort of movement. So you can see the platysmal bands pulling at my neck skin, and over time with consistent pulling, it can contribute to crepiness of that neck skin. And so less often, usually every 6 months or so, I'll get injections along the platysmal bands so that I don't do that constant pulling and straining against my neck skin, leading to that crepey appearance.